We're so happy to be with you today. I definitely want to thank everyone who is here with us and who will be participating in this training. I just want to preface by saying this particular 1 hour or 75 minutes with us will be divided into two sections. The first part, we're really going to go over some of the requirements. I heard Sergio, I think I heard that correct, who's a certified peer, and maybe there's some other folks who are here who are now certified Medi-Cal peer support specialists, and we're so excited to have you all, and you as well, Bill. That's awesome. So many of you are certified and are moving up the ladder and potentially becoming those supervisors, and or have supervisors and not really sure that they're meeting those qualifications. And so this is a Q&A to really give you that background information about those program requirements and what that looks like. And then we're going to move into the second portion of our training here with Gisselle, who's going to give you more tips and tricks, specifically looking at supervising peers. So I just wanted to preface by letting you all know we're going to stick to those two themes during our talk today. And when I transition out, we'll give you an opportunity to also ask us some wonderful questions that involve more of the program side, so I can help answer those. All right. Will you let me know if I am sharing my screen appropriately? Yes?
I see it now, Mayra. I see it, yes.
Perfect. All right, thank you. So guidelines and best practices for supervision of Medi-Cal peer support specialist. And as mentioned, Gisselle Galloway, our program supervisor, is with us today, and myself, Mayra Corral, program manager with peer certification. All right, and then so this is some of our team. We have had some new folks also join us, but really wanted you all to get to know us, our familiar faces. We share a lot of emails with all you wonderful folks, and I know you all call our CalMHSA peer certification program number, but we are a pretty small team. This also includes our director, our epidemiologist, our executive assistant, and our IT team. And so not very many of us. We're a really small team. And so wanted to have you get to know and see our faces, and happy to see you all too. And so let's start with the program overview. For some of you, we recognize that maybe you have different qualifications or maybe not as familiar with the peer space or Medi-Cal peer support specialist specifically, and are supervising. And so we wanted to give some context as to what this specific program was. And so the history of the Medi-Cal peer support specialist certification implementation started with the lawmaking bill in 2020, what we call SB 803. And so this lawmaking bill for peer services gave the benefit for counties to opt in the behavioral health plan and really recognize the Medi-Cal peer support specialist and the professionalization of that title. As we all know, DHCS oversees the Medi-Cal programs and the peer benefits. They set those certification standards, and they set all the reimbursement rates, and they update all the state waivers. So I know we get a lot of questions in our programs about how do I bill, how do I do this code, and how do I do that? So just putting it back on here that as supervisors continue to seek those answers from your county behavioral health, that comes from DHCS directly, as you see here. And moving into the county behavioral health, counties can opt in to those peer benefits. Not all counties recognize Medi-Cal peer support specialists, but there's only quite a few. Hopefully we get to them in the near future, but not every single county in California does recognize them as of today. And then all counties do select the certifying entity. They contract with DHCS. They set up the billing system for reimbursement, and they employ and contract and provide that oversight. CalMHSA was the agency that was selected by the counties to be that certifying entity. We certify the individuals that come through our door. We approve the training providers as well. We act as a board, and we investigate the complaints also filed against certified peers. And of course, peers satisfy those requirements that we have up on our website, and they are able to move across California and assume the title of a Medi-Cal peer support specialist, assuming it's not one of those two counties, as mentioned, that don't opt into the Medi-Cal peer support specialist title. However, for the most part, if you go to Riverside County, Monterey County, and then LA County, you will be recognized by your certification as a Medi-Cal peer support specialist. And very important to note that there is only one certification for the Medi-Cal peer support specialist. We do have 4 areas of specialization. These, for the most part, are not required, but they are a benefit to folks to continue that professional development. The only training that is required to become a Medi-Cal peer support specialist that has the exam is the initial certification. The rest of these 4 areas of specialization are really just acknowledging that peers fit into different categories. They have so much abundance of experience, and some of those experiences can be categorized predominantly into these 4 categories, which are parent caregiver, family member peers, folks working with persons unhoused, working with the persons in the justice involved, and also working with individuals in crisis. Some really great stats for you all to know. Our wonderful program here has now received over 6,800 applications. That's such a large number. Yes, definitely clap for that. DHCS funded scholarships administration. So we've had about a little over 3,000 folks receive that initial certification pathway scholarship, and they were able to complete their full certification process. About 3,000 of those folks receiving that scholarship. About 1,500, close to 1,600 peers entered through the grandparenting pathway and received that scholarship as well. As most of you know, the grandparenting process is not available anymore, but the peer certification program recognized that there were numerous peers that were already in the business and were qualified individuals who already possessed those qualifications and allowed them to come through that route without taking that initial 80-hour training. It really honored their previous work completed. So currently there are over 3,000, now we're at 3,100 individuals who are certified Medi-Cal peer support specialists. In the grand scheme of things, it's been about 1.5 years since the opening of the live exam. So 3,000 individuals to be certified is a huge accomplishment that folks are passing, and they're doing great. And up to the next point, the passing rate is 86%. So that is also major. I know a lot of folks frequently, get worried about not passing and have that concern, but the numbers really speak for themselves that 86% of individuals are passing that exam. And then about 1,200 individuals completed the CalMHSA training for the supervision of peer workers. Maybe that's some of you, or maybe those numbers might increase to include some of you after our conversation today. And we'll get a little bit into what that is. And about 174 folks received the scholarship for the parent caregiver, which we talked about in the slide prior to this, which is an area of specialization. So just getting really quickly a recap of the certifying entity and what we do specifically. We perform all of the administrative functions and development of our standards and procedures. We're responsible for the certification, examination, and enforcement of those professional standards, as I mentioned, for Medi-Cal peer support specialists. We approve those providers. We investigate those complaints. That is very important for us because those are the actions that are taken against any individual who violates those code of ethics. And we're just a constant, continuous quality improvement. So I know, as Billy mentioned earlier, that you go onto our website regularly, and you probably have seen how much it has changed throughout the year or two. It's just been a constant evolution, and we really take the feedback that peers and folks give us really seriously and try to make things as smooth as possible. So if you haven't gone to our website, this is what it currently looks like. We definitely have made a lot of things more accessible. Folks can translate our page into different languages. We have all the information on what the requirements are for the certification, all the information around training, who those approved providers are, the exam information, how many languages you can take it. Now it's in English and Spanish. The resource library that has wonderful resources, all the fees, and then all the data, which you can look up how many folks are registered. If you happen to want to hire or employ someone and you want to confirm that they are a certified Medi-Cal peer support specialist, their name will also be on the registry. And all that wonderful data that I also shared is under this last button with the data information. And then we're gonna not get too much into the scope of practice of a peer just because Giselle's gonna spend a lot of time on that, but just for many of you who might be, maybe we have some new supervisors with us today who are just now supervising peers. So just very important to understand the scope of practice of a Medi-Cal peer support specialist is a lot of our focus can be categorized into three main areas. Educational skill building groups, so very much providing supportive environments which consumers and their families learn coping mechanisms, problem solving skills in order to really achieve those desired goals. Groups promote, skill building for the consumer in areas of socialization, recovery, self-sufficiency, advocacy, development, natural supports. Engagement, we really truly rely on peers because of that experience that they have. And you all know that peers truly they are the tool. They are a walking tool when they come into the room and they're working with multidisciplinary teams. So they are engaging individuals into really providing that support to consumers and clients who are walking into those offices and attempting to get services. And engagement may include supporting consumers in their transitions between levels of care and supporting beneficiaries in developing their own recovery goals. And then lastly, not to be confused with therapy, but therapeutic activity, which is a little different, is a structured non-clinical activity to promote recovery, wellness, self-advocacy, relationship enhancement, development of natural supports, awareness and values maintenance of community living, skills for support the consumer's treatment, and attain those recovery goals within their communities. Activities may include, but not limited to, advocacy on behalf of that consumer, promotion of self-advocacy, resource navigation, and collaboration with consumers and others providing care. That's such a wordy one. And providing care of support to consumer family members or significant supports. So all that to say, if someone's struggling with maybe needing resources or wants to start a group in the community that really promotes maybe like Alcoholics Anonymous or different groups like that, and then really advocating for them to get some of those resources to continue their path of recovery. And so I'll leave it to Gisselle and I'll stop sharing. So does anyone have any specific programmatic questions of anything that I shared before Gisselle goes into the specific of supervising a peer?
I had a somewhat related question.
Of course. Yeah.
This is Tristan. I use he, him, his pronouns. So my question was, you mentioned about the specializations and you mentioned about how some of them got some scholarships. Is CalMHSA going to offer scholarships, for example, the Justice Involved training? I mean, I did one of those trainings at Pain and Brain. I'm one of the lead peer trainers. and we didn't have scholarships. So is that ever coming down the line, or because it really could make a huge difference for some of the folks who would need to take this training?
Yeah, great question. So CalMHSA is not a grant providing agency, meaning we don't produce the scholarships. They come to us from DHCS.
Oh, that's right. I'm
And
at
so
the
DHCS did cut that off in the sense that that deadline ended on December 31st of last year, 2023. So unfortunately, those scholarships could not continue. Who's to say in the future? But as of today, we don't have that grant
That's
to be able to
DHPS.
do that.
I would ask them, right?
Yeah, well, it's a continued advocacy for us too. We do hear the need. Folks definitely come to us and bring this to our door, and so that's a continued advocacy that we will have, and maybe somewhere down the line we can apply for that, or that could be something that we would receive. But as of today, we don't have the funds for that.
Okay, I would like you to continue advocating for this because I'm a person with
Yeah,
lived experience.
yeah,
I'm also a person who went to the criminal justice system, and I know that a lot of
yeah,
the folks taking this particular, justice involved training
yeah,
have the skill and the need to
yeah.
develop their skills, and also often, it's just if you got to pay $900, they're just it's
It's a
not
lot.
they're not able
Yeah.
to do it.
No,
Yeah.
yeah, I appreciate that comment, Tristan. It's definitely important. And the justice involved, I have to say, has been one of the area specializations that has been extremely popular. And I think it's really because of the need that folks understand that there needs to be a little bit more of that support to really help them professionalize themselves and understand the context of that experience. It's very heavy, and those folks that have gone through it really understand the importance and significance of really coming out and being a professional and having that title recognized more so. So yeah, definitely we'll continue our advocacy efforts, and I appreciate that, Tristan, as well. So thank you. I'll let Gisselle take the lead.
Thank you. I'm going to go ahead and share my screen and start my presentation. Give me a quick second to get it set up. And here. All right. Can everyone see my screen?
Yes.
Awesome. Well, we're going to transition and talking more about the Certified Medi-Cal Peer Support Specialist Supervisor requirements. We're going to share some best practices as well as a best practice guideline that we have for you. My name is Gisselle. I am excited to be here with you guys. I am a peer with lived experience, and I like to say that I have expertise in thriving in recovery with over 20 years of recovery under my belt. I am also a certified Medi-Cal peer support specialist and recently a registered drug and alcohol counselor. And I also supervise the program here, the peer program at CalMHSA. So I'm just excited to be here with you guys and just kind of share, like I said, some of the boring stuff like the requirements, but we're hoping to make it interesting for you guys and have a little bit of interaction. So here we go. So first of all, let's cover the important stuff. What are the requirements for supervision of peer workers? Remember that these requirements are set by the Department of Healthcare Services, so we are here to enforce those. There's 3 different options to be able to be a supervisor of other peers that are certified as Medi-Cal peer support specialists. Option 1 is to the supervisor, him or herself, have a Medi-Cal peer support specialist certification, have 2 years of working in this behavioral health system, and has completed the approved supervisor training. So that would be option 1. Option 2 would be a non-peer behavior health professional, including a registered, a certified substance use disorder counselor, have worked in the behavioral health system as well for a minimum of 2 years, and again, have completed the approved supervisor training. And then option number 3 is to have a high school diploma or a general equivalency degree, a GED, have 4 years of behavioral health direct service experience, including peer services, and have completed, again, the supervisor training. Can you guys see the trend? Everyone needs to complete the supervisor training according to DHCS. So the supervision of peer workers training, what is that? Well, it's a training that has been adapted from SAMHSA's best practice standards to supervise peer workers. CalMHSA, so we actually host this training, and it's at no cost to anyone. The training is about an hour, self-paced learning, so you can do that on your own time, on your lunch break, what have you, give or take an hour. And the training registration is available on our website at the capeercertification.org. The Department of Healthcare standards require that all supervisors of peer workers to complete the training within 60 days of starting supervision of a Medi-Cal peer support specialist. So remember those 60 days and mark that in your calendar if you're recently became a supervisor or peer workers that you supervise have recently been certified as Medi-Cal peer support specialists. So it kind of works both ways, and make sure that you take a note of that, those 60 days. So how do you register? Well, everything seems to be on our website, which is really great. Again, you go to capeercertification.org. I did put that link in the chat a little earlier while Mayra was speaking. If you look at the red arrow here under training, we have the home menu at the very top here, and there's sub menus over on the left kind of panel here, if you can see that here on the side. And here you'll see the training for supervisors where that red arrow is. And under training for supervisors, you'll see 2 hyperlinks there in the middle under supervision of peer workers. The first one is the state qualifications that we will be talking about today. The view best practices guidelines, which we will also be looking at today. And then if you see that green button at the bottom says supervisor training, and then you see that green arrow going to that top login register. If you've already registered for the Medi-Cal peer support specialist, that's going to look similar or familiar to you. So that supervisor training button is going to take you kind of to that same dashboard like when you logged in or registered. If you already have a registered account, then you'll be a returning user. You'll log in like you did before. And then on the left-hand side, you'll see that supervisor training on the dashboard. Okay. If you're a new user, that screen will look a little bit different. You'll get a pop-up with some fields that you have to fill out. You'll be marked by little red asterisks or exclamation marks. And so just put in the required information and you will create an account. And then you'll see the dashboard that looks like it did for the Medi-Cal peer support specialist. And again, on that dashboard on the left-hand side, you'll see supervisor training link. So that's how you access the training. So let's talk about some of the standards and best practices that you'll see either in that training and as well as the best practice guide. So you will find on our website a best practice guidelines for employing certified Medi-Cal peer support specialists. Where do you find that? Well, I showed you earlier in that training for supervisors page, that second hyperlink there that says view best practice guidelines for employing certified Medi-Cal peer support specialists. Hopefully you guys can see that okay. That is going to take you to download our best practices guidelines. It's like a workbook, but it's a document in PDF. And you can also go to our resource library. So if you look at the very top corner here of our screen, it also says resource library. And then also there's where you can find any of our documents and handouts and PDFs. So you'll also be able to find it there. So what is this guide all about? I don't know if you guys have heard about it or not, but the guide was created by CalMHSA's Peer Program Stakeholder Advisory Council. Earlier, Mayra said that we act like a board, and so part of our function is to have a stakeholder advisory council, and so we created that with that collaboration. The purpose of this guide is to prepare workplaces to effectively employ certified Medi-Cal peer support specialists here in California. We have a mission that extends beyond recruitment and really encompasses creating an environment where these professionals are seamlessly integrated and embraced by other clinical workers. We want to ensure that our workplaces here in California not only understand the value of peer work, but also really understand its benefits and that they're equipped to employ and develop and maximize these potentials of our certified workforce. And that's the mission of the guide. Our intended audience for the guide is obviously workplaces here in California that are in process of incorporating the certified Medi-Cal peer support specialists or working towards certified their current peer workforce, right? A lot of employment agencies have behavioral health have peer workers that are now becoming certified Medi-Cal peer support specialists. So definitely is our intended audience. In our guide, you'll see that we do express our sincere gratitude to the CalMHSA Medi-Cal Peer Certification Stakeholder Advisory Council, that's a mouthful, in collaboration with CalMHSA for dedicating the time and sharing all of their expertise in shaping this guide. There's a lot in there to really kind of guide us for best practices and to be able to integrate the peer worker into that behavioral health setting. So the guidelines has a lot of, I think, really good stuff in there. It has an overview of the peer support specialist in behavior health, and that includes the value of the peer support specialist, unique challenges. It also has an overview of the peer support specialist in the behavior health system. It covers recruitment and hiring. It helps workplaces establish a welcoming and inclusive workplace. It focuses on how to train and develop our certified Medi-Cal peer support specialist. It also goes into really understanding peer support services. As you saw in some of the qualifications, some supervisors may not be peer workers. And so we want to make sure that they understand that. What are the services provided in the scope of practice? It covers supervision and support for the peer worker, and it also includes a workplace readiness checklist. So hope you guys can take a look at that and let me know what you think. The appendix also has some really good resources. It has some resources on like teaching about the history of the peer movement, some resources on recruitment and hiring, including like sample interview questions. And it also has some really cool resources for evidence-based practices. So we really hope that you go there and download it. It's full of great insight. So some essential insights for peer supervision that we wanted to just talk about today was obviously the scope of practice of a peer support specialist, right? Supervisors really should be able to understand what that scope of practice is, what is a Medi-Cal peer support specialist, what should they be focusing on when it comes to behavioral health systems? We also want them to understand those integration challenges, right? What are those integration challenges? Maybe some of the supervisors are aware of them, some may not be. You know, what are they and how do we mitigate those? You know, what are some ideas that are out there and people that have been in this longer than us, you know, how do they mitigate those challenges? Again, the value of peer support specialists. I really believe that a supervisor should be able to just, you know, blurt out the values of a peer support specialist. Can anyone either let me know what are the benefits of peer support specialists in behavioral health? Can you guys want to put it in the chat and maybe Bill, you can read some off? Who can tell me the values? I know some of you could just like blurt those out. Bill, is there anything in the chat?
Nothing yet.
All right. Well, I'll give you guys some
Okay.
hints.
Power of shared lived experience in building relationships.
Yes, absolutely. Shared experience. And what's the value of that shared experience, right? Is increased hope, increased empowerment. Another benefit is improved outcomes. When I first got into this business, I think my first CalMHSA stakeholder meeting before I was employed with them, they were presenting some data from some of the research that was done. And with engagement, the completion of treatment jumped from like 3% to 93% for a 3 to 6 month program. I mean, those numbers are staggering, right? Supervisors should really know that. Reduction of stigma, right? How does the peer workforce really help with that? Enhanced cultural competence, because you're going to get a much diverse workforce when you're employing those peers with lived experience in substance use disorder or mental health, right? So yeah, we really want our supervisors to really understand and embrace the value of the peer support specialist. Understanding the 17 core competencies. What are those core competencies that we've built the Medi-Cal peer support specialist out to be? What are those skills? What are the knowledge? What do we want them to be really good at? And how do we want to enable them to use that lived experience and their shared stories in a way that's going to give us those improved outcomes? The code of ethics for Medi-Cal peer support specialists is super crucial, right? It's a great insight. All peer supervisors really should be familiar with those and be able to ensure that their employees are reviewing those, that, really maybe not know them all by heart, but the essence of the code of ethics. And of course, implementing policies that support the peer workforce. So what are policies that support the peer workforce? How is that different, right? Well, their job descriptions are going to be different, right? Some of that evidence-based practices, we want to make sure that we're implementing those policies that really are based on evidence-based practices for peer workers. Confidentiality, boundaries, self-care, right? Those are integrate as supervisor into our policies to ensure, again, that we have the best outcomes for our peer workers and for the clients that they are supporting.
Gisselle, we have another response in the chat. It says,
what was it?
Helping advocate and connect clients to their larger behavioral health support team and services.
Absolutely. Advocacy is such a big one, right? It's so important because sometimes we understand what that peer needs in a way that maybe the medical team might not be able to understand that. And so advocacy is huge component and one of the 17 core competencies. I think it's like embedded in almost all of the 17 core competencies, but I know that it's in there. Thank you for that. And thank you for you guys participating. So let's talk a little bit about these supervisor standards. You'll find some of these in the best practices guide as well as in the supervisor training, but I just kind of wanted to take a little time to kind of discuss some of these. So one of the things we have to do as an effective supervisor is provide regular and effective supervision. So what does that look like, right? What do we have to do to provide basic support for work coordination, for communication and administration, right? And to ensure that our peer workers are following the administrative procedures. What may that look like? Well, the first thing is we have to ensure that we are having regular supervision, right? That there are one-on-one meetings. If you're not meeting with your supervisor, don't be afraid to ask, like, are we going to implement one-on-one meetings? How do I get and provide feedback? That's going to be really important, right? How are you assessing the quality of my work? Et cetera, et cetera. As supervisors, we should know what their workload is. We should be able to be providing feedback, review blockers, and then ask for feedback. What do they need? How are they doing? Is there anything, one question that I always ask my employees is is there anything that I can support you with? I always start with what's your workload looking like? And then I almost always end our one-on-ones with, is there anything that I can support you with? Right? That's really important for them to know that we are here, that's our job as supervisors, to ensure that we are here to remove any blocks and to really help them to perform their very best, right? So assessing that work and the performance, reviewing that workload or the caseload of your peer worker, conducting regularly scheduled meetings as we talked about, and then record keeping, right? That's going to be really important for a Medi-Cal peer support specialist. And so we want to make sure that they're trained adequately and that we're auditing the record keeping to ensure that it's following the standards as required for Medi-Cal billing. Let's see, thing is not moving. There it goes. So we talked about providing regular and effective supervision. So why do we do that? Well, it's going to help our peer support specialists strengthen their self-awareness, their skills, and we're also going to be able to provide services for them to maintain self-care, right? So asking, how are you doing with your self-care? They had a difficult conversation, they had a difficult interaction, and make sure that they have that time to be able to talk to a supervisor about how that went, what could have done better? Do they need any self-care after that? So your regular and effective supervision should include providing feedback on their performance, at least a yearly evaluation, hopefully there's more than that so that those yearly evaluations aren't a surprise. Always trying to provide that strength-based affirmations, working off their strengths, being, validating, having empathy for the concerns of the peer worker and providing encouragement. And then, of course, like we talked about, really promoting self-care practices. We have to remember as supervisors that peers are people helping people, and it's our job to support them to do that. And so it's important that, again, that we are having the regular times and that we're formulating those times in a way that really create that value for the peer workers, right? I was at a job before where I had a manager in our one-on-ones and he wanted to just get some exercise done. And he would just say, let's go to the gym or let's go for a walk for our one-on-one. And I was like, what? Like, can I even talk privately if I'm like jogging down the street, So just making sure that, you're providing that time in a way for the one-on-ones to really strengthen and improve those outcomes. We talked about the knowledge of the code of ethics, right? Those are really important. So supervisors should know who created that code of ethics. Well, it was the Department of Healthcare Services, right? What is it? Well, it outlines the principles and values that peer support professionals should adhere to. And why? Well, it's going to maintain the professional integrity. It's going to protect stakeholder interests. It's going to protect the peer worker. It's going to protect the client. And it's going to enhance the delivery and quality of your services. So supervisors should be quite knowledgeable on that code of ethics. And again, I think I mentioned it earlier, it's just really talking to the Medi-Cal peer support specialist to ensure that they read that completely and to understand that there are sanctions for violations. I talked to a peer in the workforce. I do some volunteer work in my nonprofit, and one of the girls got a job as a peer support specialist and was picking up the client, taking her to appointments, and it started happening where they started going to the mall together and Starbucks together, and the participants started purchasing things for the peer worker. And in one of those interactions, the peer worker, she was taking the peer worker to the shopping mall, and the participant asked, how much money should I bring? You think $100 is fine. I want to buy shoes and do my hair and something else. They were going to do something. And when the participant went back in the house to get money, the peer worker texted her, bring 200. And, the family saw that and then started questioning, looking at the spending, reported it to the agency, and then she was let go with no warning, no, slap on the hand, just like, you should know better. It's in the code of ethics. She shouldn't be spending money on you. I'm sorry, we're going to have to let you go. And she was devastated. She was devastated. And I thought to myself, well, you do have to sign that, so I think it's really important for supervisors to ensure that our peer support specialists know that there are, violations. Luckily, this person didn't get a reported or a sanction or a violation, but she did lose her job. And so it's going to be really important for supervisors to ensure that, your workers know that. And then really ensuring to model those ethics, right? And having boundaries and not being afraid to ask questions like, hey, I saw this interaction. Can you tell me more about that? Or, did you guys come back from Starbucks? Did she purchase, did you purchase your own drink? Like, that's okay to ask as a supervisor. And I'm not sure how it all works in behavioral health if they're really doing that, but I think it's important for supervisors, again, to be knowledgeable, to model, and to not be afraid to ask questions. So here are the code of ethics principles, right? We talked about some of these like advocacy, confidentiality, but looking at these as an ethical principle. We know what hope is, but what is hope as an ethical principle, right? Can anybody answer that like off the top of their head on the chat? I don't know. Right? It's a little difficult to think about it. What is hope as an ethical principle? And how does a supervisor help with that? Right? Well, hope as an ethical principle is how we react to our participants, how we deal with setbacks, how we deal with resistance, right? If we have a participant who says, I'm not going to do that no more, and you go, well, fine, then don't. It's like that doesn't come from the ethical principle of hope. And so we know some of these terms are really understanding them as ethical principles is going to be important for someone in that supervision and someone in that role. And then lastly, I wanted to just provide some resources, and we'll put some of these on in the chat for you guys. But the general certification information is on our website, the code of ethics. We do have details on some approved training providers. And as some of you heard before we started, that there are some providers that are offering financial assistance with the program or the training or maybe even the exam. So please go onto our website, take a look at those resources that are there for you. We have an exam preparation guide. I believe that's being revamped, and we should be having a new one up soon, which again has been edited and hopefully improved through all of your feedback, all of those emails and those phone calls and stakeholder advisory public meetings where you guys attend and say, hey, can you improve this? We try really hard at CalMHSA to really listen to our peers and to the workforce. You guys have been out there way longer, than CalMHSA. And so we really want to honor that and to use that expertise that you guys have out there. The link for supervision of peer workers, and of course the best practices guide. So you guys can download that and share that with your employers. Ways to communicate to us. We are always here for you, and we try to respond to you in 24 to 48 hours. You can always go on our website. On our website, if you go to the contact menu, you can actually become part of our mailing list so that when we send out bulk emails, you kind of be in the know of what's going on at CalMHSA. We do send out a lot of our announcements will also sometimes be sent out in listserv. So if you want to be part of our email list, please go onto our website and click the contact, and there's a little box there that you can add yourself to our email list. If you have a question that you need answered, feel free to call us. There's our phone number. And we're, usually answering phone calls 8 to 5. To be fully transparent, it is a voicemail box. I have heard feedback like, you guys never pick up. And I was like, oh no, it is a voicemail box. So please leave a message, like I said, with your phone number, best time to call you. And again, we work off that queue all day to try to call folks back in the order that they were received. So yeah, that's how to contact us. And thank you so much for being here. Does anybody have any questions for me? I am going to stop sharing. So I don't see any hands up or any questions or anything in the chat. If anyone doesn't have any questions, we can let you guys go on a break before the next meeting. Info slide, absolutely can. Let me get that back for you.
Gisselle, there's a couple questions in the chat.
Okay. Oh, sorry, I'm trying to put that back in.
Do you need me to read those to you, Gisselle?
That would be great. Thank you.
Okay, you're welcome. The first question comes from Nedria Brown. The question is, will there be a recertification for the supervisor of peer support specialists?
Good question. No, we do not require a certification of the supervisor, but we do require them to take the training.
Okay, thank you.
I put that slide back up for whoever asked on that chat, so you can grab that information.
Okay, someone who's asking you to put the information slide back up, which you have already done. The next one is more of a comment. It says, thank you, Gisselle and Mayra. Always super helpful. We use much of your material for guidance and love the work you do.
See if it reads my emoji. Thank you so much. We appreciate the feedback. We're here to serve.
That was from Vanessa. DJ says, I have a question about registrations surrounding virtual spaces. It seems like there's limited accountability when it comes to ethical standards.
I'm sorry, that was regulations. I'm sorry.
Regulations, a question about regulations surrounding virtual spaces. It seems like there's limited accountability when it comes to ethical standards.
Do you mean ethical standards when providing care virtually?
DJ?
Yes.
Yes?
Yeah, I mean, I don't think CalMHSA has anything to do with that, right? But I do think with the pandemic, I think it probably was something that was kind of opened quickly so that people could get the care that they need. But I agree with you. I think we're behind the ball, right? A little bit on really everything, right? The whole internet is really lacking regulations. So
Thank you, Gisselle.
you're very welcome. Thank you for having us. And we look forward to seeing your questions or comments or just downloads of the best practices guide. Have a great day.